Good evening, everyone. Thanks for your patience there a couple of minutes, and welcome to the HFA Blood Brotherhood webinar series. Again, thank you for joining us tonight. Tonight's webinar topic is It's Your Choice, It's Your Voice. My name is Lauren Nybert, Program Coordinator with HFA. And before we get started, I would just like to go over a few webinar points and helpful hints. You will see two audio options on your webinar taskbar. You can opt to listen via the speakers on your computer or by using your phone to call in. If the phone option is chosen, the webinar taskbar will provide you with a phone number, access number, and audio PIN. You will need to enter the audio PIN in order to be heard during the question and answer portion of the webinar. You can also refer to that reference guide that I provided to you in an email earlier today as well. Because of the number of participants attending tonight's session, your audio will be muted during the presentation portion. The phone lines will open at various times for questions as well as at the end of the webinar. However, you can also type out questions in the question box at the bottom of your taskbar throughout the presentation. Your question will be addressed as soon as possible. Tonight's webinar will be facilitated by HFA's Choice Project Manager, Wendy Owens. Wendy will introduce the Choice Project and highlight some of the specifics as it relates to men with bleeding disorders. We will open the lines at various points, and we encourage your questions and input. So with that, I'll leave it to you, Wendy, and let me make sure your audio is on. And it should be. Wendy, can you hear me okay?
I can hear you fine. Can you hear me?
Yes. Take
Perfect.
it away.
Okay. Hi. Thank you, Lauren, very much. And I appreciate everyone who is on the line tonight. Appreciate your attending this webinar. The Choice Project is what I'm going to be talking about, and it's a brand new project for HFA. It's so far been very interesting. So what we're doing is something new, something that the CDC actually has never done with a non-medical oriented organization. And what HFA has the privilege of doing is collecting data on people with bleeding disorders who do not receive care at federally funded treatment centers. So what we'll do is collect the data, basically the same kind of data that is collected at HTCs and then supplied to the Centers for Disease Control, the CDC. And then that data will be analyzed, one by HFA, and then two, the CDC will receive from HFA depersonalized, unidentifiable data from the participants, and they will include that now into the Universal Data Collection database that the CDC and other groups use to make decisions about funding and approaches and grants and forward-looking planning for the bleeding disorders community. And that's why the choice is so important, because we actually think that there are probably about 33% of the bleeding disorders community that do not receive care at a federally funded HTC. Therefore, their voice, their needs are not being considered with the decisions that the government is making with their funding and their planning, etc. So here is a map of the United States for those male universal data collection participants with hemophilia, and so all 50 states participating. But there are pockets within each one of these states. We are finding people who sort of groups that see a certain doctor or go to a certain hospital do not receive care at HTC, so they are not being considered in everything that the CDC is looking at. So essentially what we're looking for are people who do not receive care at the HTCs, men, women, and children. And we also, though, are opening up the survey for people who do receive care at HTCs, because we can get a really nice data set there and get information on folks and be able to compare. We've been working very hard with the CDC to develop the survey, and I'm happy to share a copy of the draft survey. We have just completed our feedback phase, in which we did share it with key stakeholder members of the hemophilia community, including executive directors of the HFA chapters, medical advisors, and HFA staff, and a few other people, and received their feedback on the survey. So far, so good, very positive. in the feedback that we've received. And again, happy to share the set of questions that we have. So right now we have 7, actually, so 6 and 7, contracting member organizations in the United States that are working with us specifically and receiving funding to find people in their states, in their areas, that do not receive care at hemophilia treatment centers who would like to participate in choice. So we have New Mexico, the 3 Texas chapters, Arizona, Illinois, and New York City. So we feel like we have a fairly good group of folks here, because New York, I know that New York will also reach into New Jersey, and Texas, New Mexico, and Arizona. It doesn't matter whether you live in the United States, if you receive care in the United States, doesn't matter if you're, only if you receive care, and you can take the survey. If you are from another country but receiving care in the U.S., then we would love to have your participation in the survey. And no one's going to ask about citizenship or anything like that. That's not part of what we're looking at. So for us, for HFA, our goal is to improve what we're doing, to really be able to figure out what that other possibly 33%, and that's an estimate that was based on numbers from 1998, what they need, what that group of people needs from HFA in terms of improving our programs and possibly adding additional programs. So what needs are we not meeting for that group of people? And the survey asks questions, some demographics, but very broad, basic demographic information, but really on your diagnosis, your treatment, number of bleeds, quality of life, quality of care. So that's the focus that we're focusing on for the survey questions. So we want to improve all of our various programs at HFA and see if we can expand these or alter these to meet everyone's needs based on the data we collect. So our goal is, in 2013, is to have 150 people who do not receive care at an HTC take the survey. Our overall goal for the grant is to have 300 people who do not receive care at an HTC take the survey. So we are seeking those people out. Some people have self-volunteered, and we appreciate that, to take the survey. Right now we're heading up what is called our pilot program. So if anyone on the call, or if you know anyone who does not receive care at a federally funded HTC, if they would like to volunteer to participate in the pilot, what that entails is taking the survey. It's 46 questions, and then spending maybe 10 to 15 minutes on the phone with me, giving me your feedback about the survey. Because what we're using in developing choice and in executing it is what's called participatory action research method, where we really get the community involved. We make sure that the community has a voice in the development of the survey and also in the administration of the survey. So we are using encryption of survey data. We have hired a nationally recognized data security firm to work with us to develop a plan for the secure collection and storage of this data. We are not going to ask people to provide their name and contact information. That is an optional thing. It's not something that we would require. We will ask everybody to answer all the questions that they can. There will be opportunities to say, I don't know, or I prefer not to answer, but we'd like to get as many answers as we can. We will have paper-based survey that will be entered in the database, and the paper will be destroyed. We also have online surveys. The survey will be in English and in Spanish. So we're looking at how do we know if this is successful. We're saying, okay, people who do not receive care at HTCs take the survey, then we're doing well. And if we meet or exceed our goal of 300 people, then we're doing well. We're able to reach out and find these people through different methods. So whether it's social media, whether it's webinars like this, whether it's word of mouth or annual meetings, symposium, HFA symposium, whatever we happen to do, we're working all angles, so to speak, and hopefully being able to reach out and then reach out again to a second level and a third level and find people to participate. But again, importance here and the focus for me in being willing to take on this project is that the security of the data and the privacy are protected for those people participating. It's extremely important. My background is in technology, e-commerce, and communications. I advise the Secretary of Commerce and the U.S. Trade Representative on international trade policies related to these items. So HFA is not my full-time position. So these things are near and dear to me, but I would not want to take the survey and put myself in the position of being at risk, and I would never ask anyone else to put themselves in that position. So I certainly want to protect everyone's data and information. So we have a grant period of 3 years. It will end in September 2014. We're hoping that gives us plenty of time to get up the 300 for our head count. And we would be very appreciative of anyone who would participate. We will be also want to make this an ongoing project so that we're still able to reach out and ask those people who do not receive care at HCCs about what they need, about how their care is and how their lives are. So we will report our findings. We will be making these findings available to the community. The data and information collected by the survey belongs to HFA and only HFA. No one else, not even the CDC, can have access to the full, complete data set because we'll only be sending certain information over to the CDC. HFA will be protecting this data in a secure manner, and then we will be the ones who present it. If someone wants access to the data, they would have to go through HFA and a whole written contract and a whole review as to why they would want this data. So it's we're making it very difficult for anyone else to get a hold of it. So the CDC wants us to present at their national conference. NHF will be writing up articles for medical journals and bleeding disorder publications. And we'll also be sharing it, of course, directly with our community. And that's who is going to know this information first. So I kept this short so that we would have ample time for questions, because I know that there may be concerns and so forth. And I look forward to your questions, because I really want to be able to respond to this community and what you guys need. So Lauren, I'm happy to answer questions.
Okay, I'm going to open the phone lines now then. So if anyone has any background noise, if they could just quiet that or go to another room. I'm going to open everybody up here. Okay, everyone's open up. Feel free to jump in. Okay, we got a question in the question box. Just open it up. You said you were working with the various state organizations, but I'm assuming people from other states can participate as well, correct?
Yes, that's absolutely correct. We will have a link on the HFA website that will allow people to access the survey, take the survey, and also if they want a paper version, we'll be able to do paper versions, send those out. We also will be attending various states' annual meetings, holiday meetings, and so forth throughout the next 18 or so months, and we'll have basically a choice station for people to participate. So yes, anyone, anywhere in the country.
Okay, thank you. And everyone can feel free to type a question in the box as well. I'm trying to diminish some of the echoing, but feel free to chime in as well. Okay, we have another question. Is the final version of the survey on the website, or has it been finalized yet?
The final version of the survey is not on the website. It is not finalized yet, because as part of the method that we're using to develop the survey, we have to go through a pilot process. But once it is finalized, absolutely, it will be on the HFA website, and people can look at it prior to taking the survey. And there will be questions that are general questions for all, and there will also be specifically female-based questions, and then a couple of questions that would be answered by an adult parent who has a child with a bleeding disorder. And the adult parent would answer all the general questions as well, but they also just a couple of specific questions for a parent. But all those questions, we're going to make those public and available, and you can look through it prior to taking the survey. People that have looked over the draft during the feedback portion said it took them about 30 minutes to run through the survey if they had to answer all the nested questions. So there are some questions, if you answer yes, then you end up trying to answer or asked to answer a few more questions beyond that.
Okay, we got a couple more questions here, Wendy.
Sure.
When do you expect it to be finalized, the survey?
I'm hoping with the holidays and all that's been going on, and is that we will have the final version. We will do our launch in January 2013.
Okay, great, thank you. And am I able to take the survey or read the survey to a family member who is unable to read the survey?
Absolutely. We're going to have instructions for administering the survey for all of our contracting member organizations that I listed, those 7 organizations. And we will also put those online. So it's absolutely fine. We just need to make sure that whoever is answering the questions is the person with the bleeding disorder, and that's just fine.
Okay, great. Everyone else, feel free to chime in or type a question in the question box.
Hey, Lauren, until then, I had a couple of other questions that come up, and maybe this will help people come up with additional questions. But these are kind of the normal questions that I've been getting lately. One of the questions is the purpose of the project to convince people to go to an HTC? And the answer to that is absolutely not. This is not at all the goal of the project. What we're simply looking for are those people who do not receive care at federally funded HTCs, their data, and just to know how they're doing. Are they doing well? Could we find some best practices from people who do not receive care at HTCs? And they say, no, I'm doing great. So what can we learn from this process? And another thing is, I get a question, is one of the potential outcomes of the CHOICE project for the CDC to reduce funding it provides to HTCs? And the honest truth is that HTCs receive federal support from the Health Resources and Services Administration, so HRSA, and the Centers for Disease Control. But no, there's no reduction in funding for HTCs. It's not a planned outcome for this, and I don't foresee it being something that they can use as a tool to reduce funding by any means for HTCs. But it's a concern that's been out there.
Wendy, we did get another question.
Sure.
Are they still collecting data for the UDC at the HTCs?
The answer is yes. They are still collecting data for the UDC at the HTCs. Each time that you go in, and some people only go in once a year to their HTC to receive their checkup, that your data is collected. They're looking at making some changes to the disclosure process for collecting data. And HFA is out there advocating on behalf of the patients that they really need to make the disclosure about data collection very clear, crystal clear as to what they're collecting and how it will be used. So we are using those practices here at HFA as well, because if we have the expectation that the UDC practices will meet those high standards, we certainly intend to meet those high standards.
Are there any other questions? Feel free to pop them in the box or just shout them out. Okay, I have another one here. If we know of someone to take the survey, the best place to refer them is the HFA website?
The best place to refer them when the survey launches is the HFA website. Otherwise, if you wouldn't mind, I would be happy to take the referral and put them on the list, and then I can contact them directly when we launch the survey, and I can find out if they want it in paper or if they want to do it online. So I will put up my screen again here, and you'll see my contact information. One second.
Yeah, I think it's you can see it right now, Wendy.
Oh, can you see it?
Yes.
Oops. Great. Okay.
All right. Here's another question that came in. Some blood is drawn each time I go to an HTC in the name of UDC. I never, oh, I'm sorry. I'll start over. Some blood is drawn each time I go to an HTC in the name of UDC. I never get to hear about it after that. Why is this so? Why do they have to collect this data each time I go?
Well, the question is, first, how frequently do you go? And I would certainly put that question to them. I am not as familiar with the process for the UDC data collection as I am, of course, for our data collection. And there is an organization called ATHN, so athn.org, and they may have information on their website that will help explain that. But I think it's important that you ask, simply because I don't think that the nurses, doctors, and other healthcare providers at HTCs are all too familiar with the reasons why either. So that's why we're advocating for more disclosure and help people understand what that data is being used for. And normally what they're doing when they're collecting the blood sample, and I don't know why they do it so often, but they are collecting samples that they then are able to take further data from, so specific blood data from, that they hope to use in research. But of course, no one can tell it's your blood or anything like that. But I would certainly ask, when it happens each time, or also check with ATHN. But it's a good question. I don't know.
Okay, thanks, Wendy. We have another one that has come in. You may have answered this in the beginning, but once the survey is finalized, you'll pass out all of that information to member organizations as well?
Yes, so our member organizations, all of the HFA chapters will be making a big announcement, big to-do about the final version of in the launch of the survey. So we will put it out in Dateline and on Facebook and email blast, and of course advise each one of our executive directors, board members that's available, and provide them with links and what they would need to let the community know.
Okay, great. Thank you. When do you expect to have the results of this survey to be made public?
That's a really good question, because our intention is, of course, that once we have all the data, to be able to pull that data together, and then after the close of the grant in September 2014, then to do our data analysis. But if you have any experience with data, you really want to start your analysis fairly early. So we may be putting out some early results. It just depends on what we get, and if we feel that they're viable results and are representative of a sufficiently large set of folks. So hopefully, from the first person who takes that survey, I promise you, I will be analyzing data and making sure that we're getting the data that we really need. So it is possible, very possible, though I make no promises, that we will be doing some, at least preliminary results, divulging some of that. And some anecdotal information, too. One of the interesting things that we found in this process and working with our contracting member organizations from the 7 locations is that there are people who think they receive care at a federally funded HTC, but they actually don't. And there are people who do receive care at a federally funded HTC, but they don't think they do. So that is an interesting dilemma that we've come across, is that how do we find out who receives care at federally funded HCC and who doesn't? So it's one of those things that we hopefully have a sufficient question in there to tease out that information. But that's it's something that the CDC was flabbergasted by. But then as they thought about it, and they thought, well, maybe not, because they had HCCs come on board in the past couple of years and some drop off as federally funded HCCs. So there's always that confusion that we're going to be dealing with.
Okay. Anybody else have any questions? Okay. Wendy, did you have any other points to mention or anything else you'd like to add?
I'd just like to add again, I put in a plug for anybody who knows anyone or anyone on the line who would like to participate in the pilot program, whether you receive care at a federally funded HCC or not. I certainly appreciate if you would get in contact with me. And again, it's taking the survey, and your data collected during the survey will be entered and included in the data set that we have once we are collecting data with the finalized survey, and also about 10 to 15 minutes tops with me on the telephone. And so, of course, necessity to identify yourself. But once again, everything will remain confidential. That's it. But I really appreciate this opportunity to talk with everyone about choice. Thank you, Lauren.
Yeah, thank you, Wendy. And if anyone thinks of any questions after we log off tonight, feel free to email Wendy at the address there, the choice@hemophiliafed.org. And thank you for all of your questions tonight and for joining us. So thanks, everyone. Have a good night.